afternoon, Dr. Crump. Is now still a good time to go over the pharmacogenetic test results of your patients?
Yes, it is. Yes, it is. Let me pull up the spreadsheet you said so that I can follow along with you.
So most of the patients on this list I've coded green, meaning no medication changes are needed at this time. However, there are several patients that I'd like to draw your attention to. 2 I've coded as yellow, meaning a medication change is likely warranted, and 3 I've coded as red, meaning a medication is needed.
Oh, I can see that, but before we get started, I had a question when I looked at this before. What is the relationship between the phenotype and the metabolizer status?
Well, these tests assess relative activity of enzymes, mostly in the liver, allowing us to predict how well an individual clears a drug or metabolizes a prodrug into an active metabolite. So the phenotypes therefore are denoted as ultra-rapid, extensive, meaning normal, intermediate, or poor metabolizers. Does that make sense?
Yes, it does. Thank you for that brief explanation. I appreciate it.
Of course, that's what I'm here for. So if you look at the first patient highlighted in red, his results indicate that a change is needed for his clopidogrel. He's an intermediate metabolizer. Since clopidogrel is a prodrug, this means it's not being activated by the liver, and there's an increased risk of therapeutic failure due to lower concentrations of circulating active drug. However, since this patient is older than 75 years old, he's not a good candidate for an in-class alternative, prasugrel. For this reason, I would recommend switching to Eliquis 5 milligrams twice daily, which will significantly decrease his risk.
Well, that makes perfect sense. Especially important for this patient since he was hospitalized for a stroke last year, and his anticoagulation status is really critical to preventing a secondary stroke.
Okay, great. Let's move on to that last patient. He's listed as an ultra-rapid metabolizer of the Brilinta, meaning that the patient has an increased risk for therapeutic failure due to lower concentrations of circulating drug. I would recommend a switch to clopidogrel 75 milligrams once daily, in addition to aspirin 81 milligrams once daily. This also represents a significant cost savings, around $4,000 for the plan and around $450 out of pocket for the patient. Most importantly, making the switch decreases the risk of therapeutic failure and all that goes along with it.
Well, I like the combination of better therapeutic effect and the cost savings. Certainly the patient will like that. I'm seeing why now these tests are recommended for patients with cardiovascular disease. I'll be glad to go ahead and send those orders in right away.
Would you like me to follow up with each of the patients that I've flagged here to go over the medication changes and test results?
Well, I'd like to follow up with that first patient myself. As I said, the issue is very critical, and I want to be sure that we adequately explain to him what the change is all about. And then I'd like to have you contact the other patients, but before you do, I'd like to have my office staff contact them and let them know you'll be calling to discuss these results.
All right, thanks. That makes sense. I'll look forward to her call. Thanks for taking the time to follow up with me today and go over these results. And just as a reminder, we're always here to reevaluate your patient's PGX results based on their changing diagnoses and medications.